Okay, so now Laura is gonna look for trigger points. So trigger points are just where the muscle is bound up and where it's gonna cause pain to radiate in other areas of the body. She just feels around with her thumbs and looks for the lump under the skin. What type of texture would you say it is, Laura?
It's very firm, and you can see where we normally should have a spongy or a pliable muscle. When we hit like a trigger point, we lose that pliability, and you can literally feel the knot roll. So I can isolate it, and then we go right into the center of it.
So we just mark it with the Sharpie to keep on the spot that we want to inject. Then we clean the skin with alcohol. So we just wipe over it. And then the next thing we do is we apply what is called ethyl chloride spray. It comes in a liquid form. We spray it onto the area to kind of numb the skin up for that poke. It just kind of freezes that skin, gets it nice and cold, and then we poke the area and we go into where you feel you're in the knot, and we inject 1 milliliter of solution into each spot. And that just helps relax that muscle and rehydrate it. There will be a little bit of numbness in that area from the lidocaine, and that lasts about 2 hours, I would say at most. And it kicks in about probably 5 to 10 minutes after the injection. With these trigger points, some things that can happen is when you're injecting it, that pain could radiate all over to different areas in the body. So Laura here is injecting the neck. That pain could potentially radiate down to her elbow or to her fingertips or down her back. Trigger points are all about where the muscle is bound and wound up. We inject it in there to relax it. And if that muscle is bound there, it can be pulling on other muscles that could be in pain as well. But we just inject 1 ml of solution in each area to help relax it, and over time it'll help release those knots and get rid of them so that you can get back to doing the things you need. On people who do a lot of desk work and computer work, their main trigger points are going to be in their cervical area because you are hanging your head as you're typing on that computer, you're sitting forward, and your stress and tension is usually in those shoulders. But trigger points can be used all over the body. It doesn't have to just be in the neck. We do it in the thoracic area, the lumbar area, and wherever else we need to release knots.